Hi, good evening, everybody. Thank you for joining, and thank you to Ryan Glode for organizing. So we are going to be talking tonight about obsessive-compulsive personality disorder. But first, just a few kind of overall overview points. So first, though the title is Obsessive-Compulsive Personality Disorder, as defined by DSM-5, which I'll explain. This applies not only to people who experience the full cluster of symptoms of a personality disorder, but also for the many people who have traits of this personality style without it going to the point where it's the full-blown personality disorder. So the information that we'll be talking about tonight will apply both to people who have obsessive compulsive personality disorder on the whole, but also those who simply have different traits of this personality disorder in certain ways that can be very adaptive. Very often people have an OC personality style, or even those who have OC personality disorder are very high achieving, very perfectionistic, people who tend to set very high goals for themselves. So a number of the traits that we'll be talking about can, to a point, be very adaptive. But for some people, they reach a point where they start to work against them and it starts to interfere with relationships. So we'll be talking about that. But this, like any personality style, these traits fall along a continuum. And so there are people for whom they have a couple of traits that you notice that can be a little challenging, and then others who have kind of the full spectrum of these traits and behaviors. All right, so I am going to try to do a screen share here. So hang on with me while I try to get this going. Hold on one second. Okay. And sec. Wait a second, hold on, sorry. Okay. Okay, here we go. Sorry about that. All right. Okay, terrific. All right, so as I said, we will be talking about obsessive compulsive personality disorder, but also about the different traits that comprise this personality style. There are a couple of different reasons why I myself have developed a special interest in working with folks who have this personality style. So I am a clinical psychologist and I work with people on a number of different issues, but I specialize in treating anxiety disorders. And I also do a fair amount of work with couples. So in my work, treating people with anxiety, I see a lot of folks who have an obsessive compulsive disorder, and there is some overlap between OCD and OCPD, and we'll talk a little more about that. But in my work, seeing lots of different people who have obsessive compulsive disorder, I frequently encountered people who also had obsessive compulsive personality traits or full-blown OCPD. The other avenue through which I've often worked with people who have OCPD is in working with couples. So I experienced multiple times that a couple would come to see me because one person in the relationship had an obsessive compulsive personality style, and that posed a lot of difficulties for the relationship and for the partner. And so I gained experience through couples work trying to address some of these issues. And through those two avenues, I've really developed a special interest in working with folks who have this personality style. All right, so what is obsessive compulsive personality disorder? So we will talk about that. Okay, so as defined by the DSM-5, OCPD is a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency, starting by early adulthood and present in a number of different contexts, as indicated by 4 or more of the following. All right, so multiple different criteria here. So the first is preoccupation with details, rules, lists, order, organization, or schedules, such that the major point of the activity is lost. So these are people who have a lot of to-do lists. They get very caught up in focusing on details, but sometimes in their focus on details, they kind of miss the forest through the trees. So they might get so preoccupied with doing things perfectly or in a certain way that they kind of lose sight of the bigger picture. So this might be someone who gets so preoccupied with doing things perfectly that they miss a deadline. And so they're so set. This could be a college student who's so set on doing the paper perfectly that they miss the deadline and then get a poor grade because they didn't turn the paper in on time. Or this could be someone who does underwriting for an insurance company, and they're so preoccupied with getting all of the details in and getting the details accurately that they have their paperwork is piling up and they fall way behind, and their boss is mad at them and upset with them because they're not getting any of the work done. Or I saw a couple at one point and they were having conflict because the one partner was so focused on getting all of the receipts together for taxes that they missed the April 15 deadline because he was so focused on getting all of the paperwork he needed that they weren't able to just get the taxes done and get them submitted in time. So this is someone who gets so caught up in the rules of doing something or in doing things in such detail and doing them correctly that they lose sight of kind of the bigger purpose. Another thing that you might see with this is that someone gets so caught up in a project, in the weeds of a project, in doing it correctly, that the projects around the house just don't get done because it's hard to get it to the finish line because they get so bogged down in how it's done. All right, so this person might also have perfectionism that interferes with getting a task completed. So same idea, they set such high standards that in the end, it's hard to get it done. So again, a person who is so set on choosing just the right words in a paper or getting just the right topic or ideas that they're not able to complete the essay and submit it in time. A person with OCPD might be excessively devoted to work or productivity to the exclusion of fun. So this is someone who might approach the weekend, wake up Saturday morning with a list of here's what we're going to get done this weekend. And it's very hard for them to just relax, at least until that to-do list is done. These are folks who might say they are just more comfortable on a work day and they find the weekends a little more challenging. This might be someone who's reluctant to take a day off to do something fun, or if they do take a family vacation, it's less likely to be sitting relaxing on a beach and more apt to be, here are all the things we're going to do. We're going to see this, we're going to do this tour, kind of a very goal-directed approach, even to fun. And I'm going to pause for a second just to be sure that I'm not boxing anybody out. So hang on with me 1 second. Okay. All right, so hopefully we're doing okay. All right, and this is someone who is over conscientious. scrupulous and inflexible about matters of morality, ethics, or values. So this is someone who has a lot of should statements. They carry a lot of shoulds. And they don't see it as this is my perspective, these are my values, but other people have their own perspective and their own values. It is, this is how things should be. And someone who doesn't do it this way is wrong. And so there can be judgment with that this is my way is the right way and my way is the better way. And other people who see it differently are not doing it well enough or not doing it correctly. And so there can be judgment of different ways of doing it, and a sense that my way is not just different and my way is right. And this is the correct way of approaching things. This is the right set of values, rather than allowing space for these are my values, these are values of the other person. The person might be unable to discard worn out or worthless objects. So sometimes there can be a reluctance to get rid of things, often for the sake of, I might use this one day or I might need this one day. I worked with a gentleman at one point who, even if there was a piece of red string, he didn't want to throw that out because you might need a piece of red string at some point. So there's a real value on efficiency and not wanting to waste anything. And so if you have a stack of travel and leisure magazines, you don't want to get rid of those, because what if you went to one of those places one day? That magazine would come in really handy. And so there can be difficulty getting rid of things. So people think of someone with an OC personality style as being very neat and organized, but sometimes there's clutter because the person might have trouble getting rid of things. So at its more extreme, that can be hoarding. The person may be reluctant to delegate tasks to others. So this might be someone who gets frustrated that they feel like they have to do everything. But when it comes right down to it, it might be hard for them to delegate to someone else because they get frustrated that the other person isn't doing it correctly. So when I work with couples, sometimes the person with the more OC personality style will say, I have to do everything. Like, I'm tired of having to manage everything. But when they agree that the partner will do something, the person with the OC personality style will say, but you're not doing it yet, or, but that's not the way to do it. And they will express frustration that, well, my partner said that he would manage the holiday cards, but it's December 5th and he hasn't written any cards yet. So there's a sense of things need to be done this way, which is essentially my way. So it can be hard to delegate because they get frustrated if things aren't done on their terms, because they view their terms as being the right way or the correct way. Okay, and then keeping with that theme of not wanting to waste, they use the term here, miserly spending style towards self or others. I don't find that helpful, because I don't think of it as being about, it's not about being greedy, but the miserly is more about efficiency. It's not wanting to waste, not wanting to spend more than you need to. And so again, it's almost like keeping the piece of red thread, like wanting to hold things, not wanting to waste or use something that you might need at another time. So this is the person who, when you go out for dinner, takes out the calculator and is figuring out, well, she had 2 glasses of wine and we didn't drink, so we'll charge extra there. And they are kind of figuring it out down to the penny, partly to be exacting and accurate, and partly because they don't want to waste money. They want to be very efficient. And then the last is rigidity and stubbornness. So these are people who like to plan. They don't tend to be very spontaneous, and it can be hard for them to be flexible. And so a person I see with OCPD might say to me, you know, we had a plan to do this with friends on Saturday night, but when we got together, they suggested that we go here instead, and that was really annoying. And I'll say, well, did you not like the place that they suggested instead? And my patient will say, well, no, it was perfectly fine, but we had a plan. Why did we need to change it? So there's difficulty kind of rolling with things. Like they have a plan, they like to stick with the plan. It's difficult to be flexible, and they don't tend to be spontaneous. Okay. All right. Oops, hold on one sec. Okay, there we go. All right, so what is the difference between OCPD and obsessive compulsive disorder? So OCPD is what we're talking about tonight, and there is some overlap with OCD. The confusion sometimes comes with the fact that there is a subtype of OCD that is called the just right subtype. And that can look a little bit like OCPD, and I'll explain that in a minute. So the broadest difference is that OCPD is a personality disorder. So that does not wax and wane over time the way that anxiety does. The personality disorder tends to develop at a younger age and then persists over time. And it's essentially central to the way in which the person engages with the world. And so it is a central part of how the person engages with other people and how they kind of approach life. It is just a part of who they are. Obsessive compulsive disorder is an acute disorder. You could have it for a period of time and then go through treatment and not have it anymore. The natural course of it, even without treatment, might wax and wane over time. So we're talking about two different patterns here. One is part of your personality, and the other is part of patterns in your emotions. Anxiety might get very high for a period of time, but then go down. So they are different in that way. Obsessive compulsive disorder involves the presence of obsessive thoughts, which are unwanted thoughts that are experienced as intrusive or bothersome, but the person is not able to get them out of their head, and will do things to try to get relief from those thoughts. And compulsions, which are usually either the mental actions or overt behaviors that the person engages in to try to relieve the anxiety and to get relief from the obsessive thoughts. As I mentioned, in OCD, and OCD is a very broad term that can play out in a number of different ways. So OCD has a number of different subtypes. One of the subtypes can be referred to or is referred to as the just right subtype. And those are folks who need to have things in order, because if things are not just right, it makes them anxious or uncomfortable. So this is someone who, if someone comes into their house and moves things around on the coffee table, the person will put the things back where they belong because it makes them uncomfortable or uneasy not to have things in the proper place. A person with OCPD doesn't tend to describe getting anxious or uncomfortable when things are out of place. It's more that it irritates them. Like, why would you move that? Like, that's supposed to be there, put it back. Or folks with OCPD will sit in my office and they'll say, like, I'm looking at the frame on your wall right there, it's crooked. Like, how do you tolerate that? Why don't you just fix it? So there's not this sense of this makes me anxious or it makes me uncomfortable. With OCPD, it's a sense of who does that? Like, this is the right way to do it. Straighten your frame. You got a piece of yarn on the floor. Like, don't you want to get rid of that? Doesn't that drive you crazy? It's more a sense of this is how things should be. And it's irritating if things are not the right way. Okay, so in OCD, the person typically recognizes that his or her standards are excessive or atypical. They know this is not how other people need to have it, but this is for me. It makes me uncomfortable when things in my room are out of order. Or if the kitchen is not cleaned up, I know it's fine for other people, but it really bothers me. It just makes me anxious. So they have insight into the fact that it is kind of their their issue, so to speak, their preference, their need. A person with OCPD really views these as being kind of universal standards. Like, who would want their kitchen like this? Like, anybody would need to have the kitchen cleaned up, or it would bother anybody if things on their dresser were all out of order. There is this sense that this is universal, that this is kind of the standard. This is what people agree to or would agree on, and other people kind of just need to get with the program. Okay. All right, so some of the epidemiological data on OCD. OCPD is one of the most common personality disorders in the general population, with the prevalence estimates ranging from 2 up to 8%, depending on the study. OCPD is diagnosed twice as often among men as it is in women. And one study found that approximately 20% of patients with OCPD also have OCPD. So there we see that overlap. Okay. All right, and I'm going to run through some case examples. So Jenna was a college student I saw who was very perfectionistic, and she had a lot of difficulty finishing her essays. She set very high standards for herself, and she would get kind of paralyzed about deciding on an idea and then her choice of words, and worrying that it was not done exactly right or well enough. And then she couldn't finish it or turn it in. And so she ended up having to take a leave for a semester because she was starting to fall behind academically. She was a liberal arts major, humanities major, and she wasn't able to turn her essays in because she would get so paralyzed, worrying that it wasn't done correctly. And so there you see some overlap between OCD. It caused her anxiety, but also really debilitating perfectionism that was part of an OC personality style. She also, she was a big planner, and she was very rigid with her plans. So she would, if she ran into a friend on campus one day, she saw a friend when she was on her way to the library, and the friend said, "I just bought a dress for the formal. Do you want to come to my room and just look at the dress to tell me whether you like it?" And she went because she was a good friend, but she was totally irritated by it. It was like, this was not my plan. I'm supposed to be at the library. So I'm so sorry. My dog is crying. I'm going to pause for 1 second. I will be right back. I'm so sorry. 1 sec. Okay, I'm so sorry. My dog hates listening to me do a lecture. Sorry, so she's better off in another room. Okay, so let's see, where were we? Okay, case examples. All right. Okay, so Grace was an example of a couple. Grace was referred to me individually by the couples therapist because she was in couples therapy with her husband, heterosexual couple, and the couples therapist called me and said, "I think that Grace may have OCPD and she could benefit from some individual treatment." So when I met with Grace, she talked about, she was very smart, very high achieving, and she had a lot of rules at home. And so some of the rules would be things like she wanted the lights to be turned out in rooms when people were not in them, because if you're not in the room and you leave the lights on, it's a waste of electricity, it's a waste of money. And of course, that's right. And she wanted people to take their shoes off when they came into the house because she had young children. And if they ran up the stairs with their shoes on, they would track mud up the stairs. So the house was cleaner if they would take their shoes off at the door. So again, she was right. Like, the house does stay cleaner if you don't wear shoes into the house. And it is a waste of electricity to turn the lights off if you're not in the room. The problem is Grace would get so focused on these rules that it created conflict between her and her husband, and also between her and her children. And so what was happening is when we would talk about it, she would say, but I'm right. Like, it is a waste of electricity and it is a waste of money. And they do track mud up the stairs if they wear their shoes in the house. And so on principle, she was right. And that's sometimes where people with OCPD get stuck. On the merits, a lot of times what they're saying is accurate. It's true. But holding on to I'm right comes at a cost. And so she was right about electricity, but every time that she said to her husband, you left the light on again, or I just had to go in and turn that light off, or look at the electric bill, it's up, it was frustrating her husband because he felt like he was constantly getting in trouble for something because she had a number of different rules. And so we had to talk about, you do value saving money on your electric bill, and you value saving energy, and you value saving, keeping your house clean, but what else do you value? And she also valued having a happy home, and she valued having a marriage in which her husband felt happy to be with her. And so being right and holding on to that and enforcing all those rules all the time was coming at the cost of the other things she valued. So we'll talk about that when we get to treatment. But ultimately what we worked on is balance, where that didn't mean that she had to like have mud all through the house and make peace with that and leave all the lights on all around the house. It just meant that sometimes she would compromise on the electric bill for the sake of having a more relaxing house. And sometimes, if once in a while the kids forgot and ran in the house with their shoes on, she would let that go for the sake of having a nice afternoon with them without any tension. So it's the idea that we have multiple values, and sometimes we compromise on one, even though we're right. We compromise and flex for the sake of something else that we value. Okay, all right. And we're going to talk more about that when we get into treatment strategies. So another case example was Priya. Priya also came to me at the urging of her partner. She also had a very clear sense of how things should be done at home and at work. And when people made mistakes, she had difficulty letting it go. So this is a very common pattern. And basically, it's that even when the person's behavior doesn't have a big impact on you, it can be hard not to kind of set the record straight if you see that they've made a mistake. So in other words, it can be hard not to point it out if they've made a mistake. And as you can imagine, it can get exhausting to live with or work with someone who has to constantly point out to you what you should have done better or what you could have done differently. So I saw one gentleman who had this tendency, and I would see him first thing on Monday mornings when I have a terrible habit of running a couple minutes late. So we would have a 9 a.m. appointment, and I would typically start at like 9:02, like nothing horrible, but usually I'd start more around 9:02. And he was very nice and lovely. So he would never be irritable or angry, but he always had to kind of tease me about it a little bit. Like he had to point it out. So he would say like, I don't know, Dr. Bach, we might have to get you a second alarm clock. So he would do it kind of jokingly, but he couldn't not mention it. And this is a really common tendency that it could be about something that they're serious about because it it has an impact on them, or it's something that bothers them, like at home. With parenting, it could be you did talking to kids, like you did a good job taking your bath, you put your clothes in the hamper, but you left your towel on the floor. And so it's difficulty just not kind of correcting any little thing that is not as it should be, or is not done in the way that the person wants it to be done. Okay. All right. And Dave was a salesperson, and I saw him over an extended period of time, and he very rarely took a day off. He enjoyed working. He enjoyed being number one in what he did. Rarely took a vacation, and he would have difficulty at work because he would get very frustrated that his administrative team did not work more quickly. So he could pull in a deal and lay it out and turn it over very quickly. And he would get frustrated that the admins supporting him didn't work more quickly because it wasn't efficient enough. And so he would have conflict with that. Or if people were late at work, if his coworkers were late, he was really bothered by that. Like, here are the rules. Why isn't everybody following the rules? And he would get very frustrated with it, which can interfere at work. So for some of these folks, the main tension is in their primary relationship at home or with family. But for some people, it's with work. It's that they get frustrated with other people for not doing things correctly. They might have difficulty working on a team because it's hard for them to delegate. They might be very critical or perceived as being very critical of coworkers because they set these very high standards, and they are frustrated when things are not done to that standard. Or because people who work with them just often feel very criticized. So the difficulty, the tension may come up at work just as well as it does at home. Kellen was another person I saw who would not drive home during rush hour because it might cause it takes some additional time, but the extra time that it took might be 5 minutes. And so this might be someone who waits at work until after rush hour just to save that extra 5 minutes. If the commute was short enough that the difference was negligible. This might be someone who said, I'm just going to work late because like sitting there in the traffic for the extra 5 minutes just drives me nuts. This could be someone who has difficulty playing with their children, like has an easier time doing homework with kids, but just play feels difficult. Or they have an easier time like coaching their kids on something, like teaching them something, doing something very goal directed, but kind of just playing or relaxing with kids might be more difficult. And the other thing that would go on with Kellen is if his wife did something like pack the cooler for a picnic, he would come into the kitchen once it was done and unpack the cooler and redo it in what he felt was the right way. Like it would save space, or it was neat, or whatever it was. Or if they would go on vacation and she had loaded everything into the car, he would take it all back out because he had a better way of doing it. So you can imagine that this causes difficulty within a relationship because the partner doesn't always want to feel like they're not doing things well enough. They start to feel like the message is that they don't do anything correctly, nothing is ever good enough, and that is hard to experience on a day-to-day basis. Okay, and then lastly, Fred set very high standards for keeping the house clean. This went to a point where Fred and his partner stopped having friends over because Fred would get so worked up before friends came about preparing just the right dinner and having the house immaculate the lead up to having friends over was so stressful that his partner just said, I just don't want to host anymore. Like, it's not even fun. And that gets back to getting so caught up in the details that you lose sight of the overall goal, the overall point. Okay, and then again, this might mean that this person may not take vacation, or if they do, the vacation is not relaxing, that they just spend it doing goal-directed things or finding tasks wherever they are. All right. Okay, so now we're going to talk about some treatment strategies. So the type of therapy that I do is cognitive behavioral therapy. So cognitive behavioral therapy is really a marriage of two different therapies. There is cognitive therapy and there is behavior therapy. They were developed separately, actually, but we use them together. And so cognitive therapy involves, it's based on the idea that behind your emotions are very specific thoughts. So they're very specific thoughts tied to your emotions. So cognitive therapy teaches you to identify the specific thoughts and then examine them to check to see whether they're accurate. And so the idea is not to teach people the power of positive thinking, but instead it's to help people examine the thoughts to check and be sure that they're accurate. So the way that I think about it is we all see the world through a lens. Cognitive therapy helps you adjust the lens just to make sure that you're seeing things clearly. All right. So some of the cognitive therapy techniques that we teach in treatment for OCPD is to challenge black and white thinking. So people with an OC personality style tend to engage in very all or nothing thinking. Things are either done very, very well, or it was a total disaster. You are very smart, or you're not too bright. They tend to see things in very black and white terms. There tends to be a lot of magnification or catastrophic thinking. So that is anticipating that something negative would have catastrophic consequences. That if you make a mistake, if you turn an essay in with a typo in it, that would be awful. The professor would think that you're not smart, and then the department would think that you're not smart, and that would be terrible. And so part of what we do is work with people on what's called decatastrophizing. So it's helping people to put the consequences in perspective. Like, no one likes to make a mistake, but it wouldn't be the end of the world. And so it's helping people, if the meat for the dinner party was overcooked, okay, it wasn't the best dinner that people had, and they might go home and say the chicken was a little dry, but it's not the end of the world. And if someone lies awake the next night thinking, but why didn't they take the chicken out just 10 minutes earlier, then they need more to do. They need a hobby. That's just weird. So it's the idea that even if there's a negative outcome, it's negative and you don't love that, but it wouldn't be the end of the world. And so it's not worth getting really upset and irritated about, and it's certainly not worth having conflict over in a lot of cases. Overgeneralization is when someone takes one event or one data point and they make a broad generalization based on that. So if they make one mistake, if they're late one day, they think I'm always late. I'm so disorganized. Or if a coworker has difficulty with something, it's saying, this person is totally incompetent. I can't work with them. So it's encouraging people to think and speak in specific, accurate terms instead of just painting broad strokes that are probably not accurate. A person with an OC personality is taught to really be mindful of their should statements and examine their should statements to see whether they work well for them, and can they really back up the should statements, or are these should statements that they picked up along the way that may not hold up anymore. So for lack of a better example, what's coming to my mind is when I was younger, my mom always made my Halloween costumes. She would sew them. And when my older sister had kids, she is a great seamstress and she would make their costumes. So I came into parenting thinking you should make your children's Halloween costumes. So for the first few years, I made Halloween costumes for my kids, but then they started to get a little bigger and the things they wanted to be started to become a little more intricate. And I thought, I don't even know how to sew. Like, this is not going to work. And I bought a Spider-Man costume for my son. He wore it all year and he loved it. And I thought, the idea that you should make your Halloween costumes for your kids yourself just doesn't hold up for me anymore. And so it's looking at the should statements that you're carrying to examine them and see whether they work for you or whether there are sometimes when it just causes unnecessary stress. Mind reading is when you assume that you know what other people are thinking. So you want to be careful that you're not making assumptions that other people are judging you or criticizing you when they may not be. And then schemas are the underlying central beliefs that we hold about ourselves or other people or the world. And so cognitive therapy can help people to identify their schemas. And so if your schema is that you can't count on other people, they never come through, then you want to examine that and see, is that true? Or is it that you actually just have trouble kind of delegating and tolerating people not doing things exactly the way that you would, right? Okay. All right, additional cognitive therapy strategies. So a big part of treatment for people with an OC personality style or really any kind of perfectionism is helping them set attainable standards. Very often perfectionists and certainly people with OCPD set very high standards that are often just impossible for anybody to achieve, certainly difficult to achieve on a consistent basis. And so it's helping people see that you can do an excellent job at something without doing it perfectly. And it helps people to practice getting comfortable with good enough. And that doesn't mean a lot of times people will say to me, I like that I do things really well. I don't want to all of a sudden embrace mediocrity. You can set very high standards and do your best and aim high, but get comfortable with good enough and tolerate that you didn't do things perfectly, but still recognize the strengths in what you did do. Again, we work on challenging black and white thinking, work on operating in the gray so that you don't see things in just all or nothing terms. And then, as I mentioned earlier, we talk about the cost of being right, because very often one of the things that people get stuck on is the idea that on the merits, they're right. Like, it is true that you save money if you turn the lights out when you're not in a room. And it's true that it is respectful to be on time. And it's true that your house stays cleaner if the kids take their shoes off at the door. But what is the cost of always enforcing those rules? And sometimes that means people you live with are stressed because you get so annoyed if things are not done correctly. So it means you have a stressful house. Sometimes it means that your partner constantly feels criticized, and so it creates tension. Sometimes it means that a night that was like set up to be totally fun just blows up because your partner overcooked the asparagus. So it's recognizing that even if on the merits you're right, there are other things that you value. So sometimes you compromise on that one thing for the sake of something else that you value, like having a pleasant night together, having a happy house, having a house that isn't super stressful, that has a little mud on the stairs, but people are happy and having a good time and happy to be home. And so it's recognizing that there are other things you value aside from just doing things perfectly. Another thing is to work with people on recognizing that these are their standards. Other people may not share those standards. So I worked with a gentleman at one point who said, I think that my partner hates me. And I said, what do you mean? And he said, my partner leaves dishes in the sink every night and knows that that really irritates me. And I said, well, I've spoken with your partner, and my impression is that if your partner lived alone, that's what the sink would look like, actually, not to annoy anybody, but just because your partner doesn't actually mind if there are dishes in the sink. And so it's helping people realize that they have their standards, but other people may not share those same standards. And helping them look at that. The other thing is moving toward the idea that different people have different styles, and there is not one style that is right. There are different styles, and each one has its own pros and cons. So within couples work, I spend a lot of time working with people on the idea that they have different styles. Neither person is right or better for their style. Each person brings pros and cons with their style. All right. Okay. And then behavioral strategies. So we work on practice tolerating doing things less than perfectly. And so often in ways that would be like inconsequential, I'll have people deliberately practice doing something less than perfectly. So I might ask them for homework. I might say, every day this week, I'd like you to just not make your bed. And that's not because there's anything wrong with making their bed. I make my bed most days. It's the idea that if you don't have time on a given day, you want to leave the house feeling like it's fine. It's not a big deal. And so you deliberately practice doing that to experience, okay, so the bed wasn't made and that kind of irritates me, but nothing terrible happened. Or I had someone who was very perfectionistic one time wrap all of her holiday gifts in paper that she didn't like. And I choose paper that I like for wrapping gifts. So it's not, again, that there's anything inherently wrong with that, but it's to get comfortable with the idea that if you don't do things perfectly, it's okay. Nothing terrible happens. We work with people on identifying the things they value in addition to doing things perfectly. So as I mentioned, you might value having a relaxing home. You might value having a fun afternoon with your kids. You value getting along with your partner, or you value turning things in on time. So you look at the other things you value where you might compromise on doing something perfectly for the sake of one of those other values. We practice being flexible, like going with a change in plan, or saying I would go to either place and letting someone else do the planning or make the decision. Practice tolerating less than 100% efficiency. So if you go to one store and you see an item, but you know it's $10 cheaper at the store that's 20 minutes away, just buy it at the first store and spend the extra $10 because your time is worth that. So practicing tolerating less than 100% efficiency. Or when you go out with friends, not to be exacting about who spent what, but to say it's fine, let's just split it equally. And just kind of sitting with not being so exacting or maximally efficient. Or get somewhere early and sit there knowing, I could have used this 20 minutes to get something else done, but just sit and relax and practice mindfulness for 20 minutes before your appointment. Practice letting things go. So when someone else does something less than perfectly, don't correct them, just let it go, especially if it's inconsequential, or like if your coworker or your children or your friend does something to help you, or they're doing something with you and they do 4 out of 5 things correctly, let the 5th thing go, don't mention it. Instead of feeling like you have to point out the part that they didn't quite get right. Set deadlines for work and stick to them, even if the work is not done perfectly. Because while you value doing things perfectly, you also want to value doing things on time. And so I will have college students I work with set a deadline that you will finish the paper by this time and turn it in, whether you think it's done perfectly or not. Or set a limit for yourself on, again, if you were working on a paper, it would be to say, read that through once more, but then beyond that, no additional edits, and you'll just submit it and see how it goes. And one of the reasons for doing that is that it's like an experiment. So I worked with a college student recently, and she was working on an essay, and I said, you know, can you just read that through once more, make any final edits, but then submit it tonight? And so she did. And I said, what would you predict you're going to get on that paper? And she said, I think I'll get a C, because I didn't take additional time to revise it. And she got the paper back and she got an A. So that was a very helpful experiment, because the outcome was evidence for her that her standards are really, really high. And she doesn't necessarily need to revise and revise and revise in order for someone else to think that her work is excellent. And then practice being spontaneous or planning something fun. So at the last minute, ask someone if they would like to go out for dinner. You know, decide that you're going to take an afternoon off. Just practice being a little more spontaneous or taking time for fun. Okay, and then lastly, we're going to talk about some strategies for partners. So one is to understand that the person's behaviors and standards are part of a style that has pros and cons. And while it can be very frustrating, it's not about you. It is just about that person's style and how they engage with the world. And so that doesn't make it less frustrating, but it can make it less hurtful. And so really recognizing that this is not about me, this is just the person is unpacking the cooler and repacking it, not because I'm not smart or because I can't pack a cooler, but because that's just what they need to do in order to feel comfortable, which again, may not make it okay, but when you're not taking it personally, it at least makes it less hurtful. And then instead of getting into debating whether the person is right, because a lot of times they'll dig in then and say, but I am right. You can acknowledge anything in their perspective that you can recognize, like to say, you know what, I do see that we save money on the electric bill when we turn all of the lights out. But it's also nice to just be at home and not be corrected and not feel like I'm going to get in trouble. So instead of getting into the weeds about whether the person is right, or like people disagree all the time about how to load the dishwasher. So instead of getting into the weeds about whether this is the better or worse way of loading the dishwasher, it's just to say, you know what, you might be right that you fit all the dishes in when you load it that way, and I don't. But it would just be nice to finish dinner and just have a relaxing rest of the night. And if 5 of the dishes didn't make it in, like I'll sit with that. I'm okay with that because I value just enjoying my time with you. And so instead of getting into the weeds about who's right and who's wrong, you can acknowledge if you see any merit in their perspective, but talk about what you are valuing more that allows you to kind of let it go. And then you want to, if you're on a team together working, if you are in a relationship, if it is a friend, you want to talk about the differences in your styles, but the pros and cons of each style. And so that person who is super organized and very detail oriented, that's a great person to have on your team when you're working on a project and you don't want to miss something and you want to stay on target with things. That is a strength. But there is also strength in being the person who is laid back and flexible and easygoing and fun and spontaneous, and there is value in that. And so it's recognizing that there are pros and cons to each style, and neither one is better or worse or right or wrong. They are just different. And it's true that sometimes the balance of pros and cons is not equal. Some styles may present more challenges than others. So it's not that all styles are equal, but ultimately every person's style has different pros and cons. And so it's recognizing the value in each style and trying to draw on that. And then you can try to work on whatever the drawbacks of a given style might be so that you're able to meet in the middle. Okay. All right. Okay, so we are just about out of time, but thank you all for tuning in, and I'm happy to respond to any questions if you wanted to send them to Ryan, and we can get back to you. All right, take good care. Bye-bye.